Good afternoon and welcome. I'm here with a distinctive Dr. Mauricio Esquivel, who has the medical practice in the town of Uvita. Dr. Esquivel, thank you for your time, for answering, giving us your busy schedule. I'd like to inform our clients and our potential clients of a lot of questions we've been receiving from them. Some of the questions are basically how a general practitioner works here, how the system works. Can you give me a brief description of what you do in this office, what procedures you would handle here, okay, so they can have some sort of an idea?
Sure. Well, basically, starting, we have two medicines, like many of the countries, private and public. This is private office of primary care. I am a general practitioner, so in this office we take primary care of pregnant women, children, elderly people, basically all kind of problems based on the general medicine, but focused on the primary care. Primary care is more preventive and treatment. But we here, we're far from the public hospitals, half an hour or 1 hour the other one. So if there are major cases of emergency surgery or snake bites, we have to send them to the hospital right away. And in this office we can do general consultation, pap smear, IV treatments, blood work, minor surgery, prenatal checkups, test for driver's license, and some seasons we have specialists here like gynecologists. We have also dermatologists and surgeon. What kind of typical treatments do you offer or the foreigners? A lot of foreigners in this area, America, Canada, Europe. What do you see that they typically come in here for? Well, take them here for any kind of problem, like from allergies, diarrheas, chronic problems like blood pressure, diabetes, or accidents, motorcycle, quads, waterfall accidents, surfing accidents. We can give them here basically prescribe all the treatment. They can get them in the pharmacy around the town. Basically everything. We've had people coming out from the public hospital because they want to have better attention or different attention, like they can go home and come back every day for an IV antibiotic medication for 7 to 10 days. So basically here we have had also hospitalization cases sometimes when patients don't want to be hospitalized in a public hospital. But when the things start getting deeper or resistant to the conventional treatment here, then we make the connection and we make the reference to the primary care hospital, big hospital in San Jose or middle hospital in San Isidro, or the closest here is about half an hour. With the rest of medication, no problem. People can get the prescriptions or control of their diabetes, blood pressure, any kind of disease they have.
Okay. What I understand that Costa Rica has the social health care system. Can you give us a little bit of light on that? Shed some light on that topic?
Sure. The social health in Costa Rica, it's been for a long time now. It's an obligation. Everybody has to pay it. Of course, different percentage. The workers and the non-workers. That has goods and bads. You know, primary care is very good if you have any kind of health problem or tumor or disease. You are covered for any kind of surgery, as long as the medicine have the equipment.
What percentage? You said it's covered for any medical invasive procedure, like surgery. The government pays, the social health care system pays for that 100%?
Or I believe it's 100%, yeah.
Wow.
Yeah, for any kind of...
So, do you know off the top of your head, you know, like let's say you go in to take your tonsils out, something, what would that, you know, the cost, do you know the cost of that?
Well, the cost on the private is very
it varies.
different. It varies from doctor to doctor. But like a tonsillectomy is, I think it's around $1,000 or
Wow.
$600. Depends on if it's totally private.
Right.
The anesthesiologist, the equipment, the surgery room.
Right.
But if you need it in the public, it's if you just pay
The monthly fee, it's covered 100%.
it's covered, yeah. Some procedures are not covered, like aesthetic and
Right. Right.
you know, and the cons are that you have to wait a lot for some things, like some specialized surgeries or.
What would be a typical time for something if somebody had a problem and under the social system that you have? What would be, you say it's a long time, what is a long time?
Well, sometimes you are wait a year
To get the procedure done?
For depending on the procedure, yeah.
And it doesn't go by priority of the need of the person, if the person can't wait that long, or the situation is so
It goes on
grave,
priority.
it goes by priority.
Sometimes,
Okay,
yeah.
okay, so
And if it's an emergency case, then it's okay. You get it done
immediately? Or?
immediately, same night the surgery. But if it's something chronic, then you have to wait in the line because there's a lot of people waiting for that kind
Understood.
of treatment.
Understood.
So the cons are a lot of people, and you have to wait months or years for some things. The good things are that you are covered for any kind of, you know, if you have to go to an intensive care unit, you can stay there over.
So basically, people that have private, this is for people that have public, but the people that have private, they can do it at any time, and the cost, let's take the tonsil example, which is something basic, is about $1,000.
For the private?
Yeah, approximately.
Private.
Just so they can get an idea.
Yeah, approximately the consultation for a general practitioner is about $50 to $60, and that's just the basic physical exam.
To come in, so if somebody, if a foreigner or anybody that has private would come in out of the street and say, Dr. Mauricio, I want to have a checkup. What's the procedure here?
Okay, well, if he wants a total checkup, we can include labs and and the EKG.
Right, right.
So the whole physical is including the EKG. Is gonna be
Approximately.
about $100.
Right.
And the labs, general labs are about $120. Okay, for include everything, like the basic metabolic and all the general checkup. Yeah, so everything is about $200.
200, and that's a complete checkup.
Yes.
That's lab work.
Lab.
That's EKG. Stress test too, or
physical? No, that would be with the cardiologist reference.
cardiologist.
Stress test or Doc or
What are we talking about then?
echocardiogram or
Yeah, what are we talking about?
that would be a sensitive process.
Okay, and what
4
cost?
minutes or 1
Yeah.
hour from here.
Cost, ballpark, so a complete physical with EKG, with cardio, with blood work. What are we talking about?
Well, the stress test is it varies a lot in cardiologist, but I think it's about $500 probably.
Okay.
So including the stress test, probably could be from $500 to $700.
So less than $1,000, you can come here, have a top physician, and have a complete analysis of a checkup of your body for less than $1,000.
Okay.
You don't have to wait.
Just for the blood work, because we send it out to the lab.
And how long does that take?
That takes depends on the samples, but usually takes like 3 or 4 days.
Yeah, it's the same. It's basically the same in the States. A couple of days.
Mm-hmm.
Now, is there, for foreigners, is there that you know of? Is there maybe a Costa Rican company, or how does a foreigner fit into the social system they want of Costa Rica?
Okay.
Are you familiar with that?
Yeah. Well, the foreigner here has to pay the public if he is resident. It's an obligation, and if he's not resident, he has to. He can acquire the INS.
Okay.
Private.
The INS.
The INS.
Okay.
Private insurance.
Is that a long process, or
that's I've heard that's fast and non-complicated, and mostly all the foreign people here have that insurance. It works good. I think they give you about 80%.
Okay.
Of course, it's chronic conditions always
So they cover 80%, you said? So the first 20% comes out of pocket?
No, they have to pay the 100% of the pocket, but they get the reimbursed.
Oh, they get reimbursed. Okay, so the initial cost, 100% comes out of pocket,
Yeah.
and then I guess what, they get all the receipts together, and
the
they
form.
prove the procedures that took place, and then they file it, and then they get reimbursed 80% of the total cost.
That's right.
Okay, and how long does it take for them to get their money back?
I think like 3 months.
3 months.
Yeah.
Okay. What about hospitalization? What about if somebody needs to go to the hospital?
With that insurance?
Yes. Yes.
Well, if it's under the coverage, it's about the same.
About the same?
Yeah.
Okay.
They cover.
Okay. Okay. We were talking earlier about something really interesting. We were talking earlier about there's certain things that doctors and professionals in the medical field do here that is what we call, back in the good old days in the United States, that we've unfortunately lost. And that's the personal relationship between the doctor and patient, the time that the doctor takes with that patient to talk to them, to see what's going on with their life. And also tell us a little bit about what you do, that you visit. I understand you go and you visit clients in their home.
Right.
Tell us a little bit about that.
Okay. Well, a few years that started because we were 3 doctors here, and we were covering basically 24 hours a day with the home visit. Now that is just me. I do home visit, but only during the schedule of the work. Sometimes if because the signal is bad where I live, sometimes the people can get in touch with me, and I can go to
their house.
Yeah, I go there. I do the physical IV treatment if needed. I have taken blood from their houses. Basically, yeah, give all the medication, give the...
So you provide basically all the services that you would provide here, pretty much, but you go to their house.
Right.
Okay.
Right.
Okay. That's very, very good.
Yeah, people get amazed at that.
Yeah,
service.
well, that's something that unfortunately, we've lost.
Yeah. But that's only here in the outsides of.
Right.
Obviously.
Well, in the town, that we take care of.
Town.
How much time, typically, when somebody comes in to see you, how much time do you spend with that person?
Yeah, well, it goes from 20 minutes to an hour, depends on the case.
20 minutes to an hour. Okay. Okay. Because back home,
in the public system, you only have like 15 minutes max to see a patient.
So because back home, unfortunately, doctors, because of the overhead that they have to see so many patients in one day. If not, they're not covering their expenses.
Right.
And unfortunately, you know, it's become a situation where the patient is no longer a patient; it's just a number.
Right.
And it's impossible for doctors to really be able to assess or to become personally involved with that patient because you don't have the time to do it.
That's right. That happens more in the public system. That's you have a short time and a lot of patients per day. That's the difference also between public and private. Private gives you a lot of time for the patient, more personalization, investigation.
Is there somebody told me that there's a special ambulatory, because what happens in a case where a foreigner lives here and needs to be taken to San Jose, to where the major hospital is? What happens in a case like that?
Okay. Well, in that case, we have to contact a private ambulance, land or air ambulance.
Right. There is medevacs that come here.
There is. Sometimes it's hard to get in contact with them, but yeah, there's a few companies and they can send helicopters or
Right.
ambulances.
And within, I know with the helicopter, what, you're like in 30 minutes to San Jose.
Yeah.
You go to the CMAC, right?
Yeah.
Yeah.
See, there are a few hospitals in San Jose, big hospitals, private. We have about 5.
Right. And under the INS, I would imagine in a case of an emergency that would have been covered. That would be covered under the INS.
Oh yeah.
Yeah. Okay. Well, is there anything else that you would like to add to our interview that we haven't covered that you think is important?
Well, I think it's just important to let people know that we are here very far from the city and far from the big healthcare hospitals, and when people come here, sometimes they want like everything, but it's hard because we're practically in the jungle. And some things are not easy to get the same day, or some appointments with the specialists might take a couple of days, few days. Yeah, I know it's faster than some other countries that you have to wait months because the doctor is very, very busy, but yeah, here you get more chances to get it in the same week appointments. But here we are retired. Like we are only the public hospitals is a good support.
Well, we have two. We have the one in Manuel Antonio, right in Quepos, and we have one right here in
Cortez.
Right, Cortez.
And the other one in San Isidro.
Right, right,
So
right.
But that it takes 40 to an hour to get there.
Right.
But yeah, and well, basically we can get all the medications we need. There are 2 pharmacies around here,
Right.
and private pharmacies, and they basically support all the needs. Just that.
Mauricio, thank you so much for your time. I appreciate it. I know you're busy. Thank you for answering the questions that we have.
Thank you.
And it's great to have somebody like you here in the community.
Thank you.
Okay?
Okay.